If your loved one with dementia is falling, getting infections again and again, losing weight, or forgetting how to swallow, please hear this. You do not have to figure this out alone. This can be signs that it is time to ask for hospice evaluation. What to actually watch for? So, let me tell you what those signs are. Ask for hospice evaluation when your loved one is becoming more confused, speaks only 4 or 5 words, or is mostly quiet. Ask when there are frequent urinary tract infections or pneumonia. Ask when they forget how to swallow food or aspirates while eating. Ask when they are completely dependent for daily activities such as bathing, dressing, toileting, brushing their teeth, or brushing their hair. Ask when there are repeat hospitalizations for infections or falls. Ask when appetite is reduced or they are losing weight. These changes can mean it is the right time for a hospice team to assess your loved one. And here's what makes this disease so cruel. It does not only rob the patient, it robs the family too. A mother or a father may look at their children but no longer recognize them, say their names, or remember the life moments they created together over many years. The patient is robbed. That is heartbreaking. I am Rupal, a registered nurse with experience in hospice and palliative care, and I help families understand care options during their serious illnesses. Let me walk you through what is happening and why. So let's see why this happens. In our previous episode, we talked about the different types of dementia, and of the 4 major types, Alzheimer's dementia is the most common in our community. Alzheimer's can begin as early as mid to late 60s. It can last for more than 20 years or until the patient dies. It is an abnormal protein buildup in the brain that damages neurons. Over time, it causes memory loss, cognitive decline, and behavioral changes. It may begin with forgetfulness. Then comes short-term memory loss. Then a person may forget self-care, important life events, distant family, and even close family. Eventually, they may not understand what is happening to them or around them. Question is, does my loved one qualify for hospice care at this time? This is the most confusing question for patients, families, and even their treating physicians or a primary care provider. Now, once your loved one has moved beyond forgetfulness and short-term memory loss, things can become much scarier. Families begin worrying about safety, but the patient may still not understand or accept the decline. That is not their fault. The disease itself may not allow them to fully understand what is happening. This can be a good time to involve a palliative care team, as hospice may not be the time just yet. This is because patients' prognosis can be more than 6 months. Palliative care can evaluate symptoms and support the family. For example, they can help prescribing oral antibiotics when your loved one gets frequent urinary tract infections and prevent a hospital visit before it gets worse. They can help assess nutrition when your loved one forgets meals. They can help families with routine medications and refills when the patient forgets to take them. And they can connect families with support in the community, such as home health, private caregivers, assisted living, with dementia care, or as dementia worsens, a nursing home with memory care unit or a dementia unit. As we mentioned earlier, the signs you're looking for to see if your loved one qualifies for hospice care are: your loved one does not speak more than 4 to 5 words and mostly stays quiet, aspirates on food and water as they forget to swallow or even chew food, complete dependency in bathing, eating, dressing, toileting, frequent infections requiring hospitalizations, losing weight with reduced appetite, falls, and much more. These changes can mean it is the right time for a hospice team to assess your loved one for hospice care. And remember, asking for a hospice evaluation does not automatically mean your loved one qualifies. The hospice team will guide the evaluation and determine whether hospice services are appropriate. You're not alone in this. A hospice team can guide you through this very difficult time. They can help you understand who to connect with and what resources may help keep your loved one safe. And hospice can come wherever the patient is. Home, in a nursing home, or an assisted living. All you have to do is ask the team to come and evaluate. If this helped, share it with a family member or caregiver who needs to hear it. And if you haven't already, subscribe. I post every week. In our next episode, we will talk about what a hospice team can do for a patient with dementia and some of the biggest barriers families face while caring for someone they love. I am Rupal, and I will see you in next episode.